Did you know some children are born with a condition that affects how they move, learn, and even eat? But many people don't fully understand it. Today, we're breaking down cerebral palsy in a way that's simple, clear, and life-changing for patients and families. From early signs to treatments and everyday tips, by the end of this video, you'll know exactly what you need to help your child thrive. Let's dive in. So, what exactly is cerebral palsy, or CP? Cerebral palsy is a disorder that affects movement and balance, meaning it can make it harder for children to control their muscles and coordinate their actions. Some children are born with cerebral palsy, while in others, it develops very early in life. Interestingly, not all symptoms are obvious right away. Some children may not show signs until they are toddlers. So, what might you notice in a child with cerebral palsy? Well, early signs often include being slow to roll over, slow to sit up, crawl, or even walk. These delays can be subtle, but they are important clues for parents and doctors to watch for. Understanding these signs early can make a huge difference, because early intervention and support can help children develop their skills and improve their quality of life. Now let's talk about the symptoms of cerebral palsy, or CP. These symptoms can range from mild to severe, and they usually happen because certain muscles in the body are weak or stiff. One important thing to know is that while these symptoms may change as a child grows, cerebral palsy itself does not get worse with age. Children with cerebral palsy can face a variety of challenges. For example, some may have trouble drinking or eating, which can sometimes lead to poor weight gain or even choking. Acid reflux is also common. This is when stomach acid backs up, causing a burning feeling in the throat or chest, belly pain, or nausea. Lung infections can occur, especially if swallowing is difficult. Cerebral palsy can also affect thinking, learning, hearing, or speaking, making communication a challenge. Some children have vision problems, like when one eye turns in or out. Seizures can happen too, showing as jerking movements, staring spells, or even passing out. Physical changes can include a curved spine, known as scoliosis, hip joint dislocations, or bladder control problems. Constipation is common, and many children also experience pain, often caused by stiff muscles, joint issues, or digestive problems. As you can see, cerebral palsy affects many parts of a child's life. But knowing these symptoms early can help families and doctors provide the right support and care. Next, let's talk about how doctors figure out if a child has cerebral palsy, or CP. Often, doctors can suspect cerebral palsy by doing a thorough exam and reviewing a child's symptoms. They look closely at movement, muscle tone, and developmental milestones. But diagnosing cerebral palsy isn't always straightforward. Every child develops at their own pace during the first 2 years of life, so it can be tricky to know for sure right away. Because of this, your doctor may refer you to a specialist, someone with extra experience in diagnosing cerebral palsy, to make sure the assessment is accurate. There are also some tests that can help confirm a diagnosis. MRI, which takes detailed pictures of the brain to check for any structural differences. EEG, which measures the electrical activity in the brain and is especially useful if the child is having seizures. These tests, combined with careful observation, help doctors understand your child's unique needs and plan the best possible care. So, how is cerebral palsy treated? The first and most important step is early intervention. These programs bring together experts who work with your child on everyday skills, like eating, speaking, walking, and learning. The earlier you start, the more progress your child can make. Beyond early intervention, there are several key treatment options. 1. Medicines can help manage stiff muscles, unusual movements, or seizures, making daily life easier and safer. 2. Equipment like leg braces, walkers, or wheelchairs can support mobility and independence, helping children get around more easily. 3. Nutrition is also critical. Some children may need special diets to ensure proper growth, and in some cases, a G-tube may be used to provide food directly to the stomach. 4. For children with severe muscle or joint issues, surgery can help put the legs or arms into the correct position, improving comfort and mobility. Each child with cerebral palsy is different, so treatments are personalized to meet their unique needs. The goal is always to help them live as fully and independently as possible. Finally, let's address one of the most important questions for parents. What will my child's life be like with cerebral palsy? For children with mild cerebral palsy, the good news is that they often live normal lifespans and can achieve many of the same milestones as their peers. For children with more severe forms of cerebral palsy, lifespan may be affected depending on complications, but that doesn't mean they can't lead meaningful and fulfilling lives. The key is support and early intervention. With the right programs and guidance, children can 1. Move as independently as possible. 2. Learn and develop new skills. In addition, special equipment and tailored teaching can make a huge difference, helping children maximize their quality of life and reach their full potential. Every child's journey with cerebral palsy is unique, but with the right care, love, and support, they can thrive in ways you may not have imagined. Thank you for watching our guide on cerebral palsy. We hope this video gave you the clear, practical information you need to better understand cerebral palsy and support those living with it. If you found this video helpful, smash that like button and share it widely with family, friends, or anyone who could benefit from this information. Don't forget to subscribe to our channel and hit the notification bell so you never miss more patient education guides like this one. We'd love to hear from you too. Comment below with your thoughts, questions, or personal experiences. Let's build a supportive community together. Remember, understanding cerebral palsy is the first step toward making a real difference. Thanks for watching, and see you in the next video.